in a rural community. When timing is everything, and concise critical care is of the utmost importance. A framework for the delivery of optimum healthcare to patient populations from the first responders to the emergency room is primary. This is the continuum of care.
Ukiah Valley Medical Center is hosting the first annual Trauma Expo. It's a countywide effort to elevate trauma services for our community.
This is massive. These are such perishable skills. These are things that you forget about or don't remember how exactly things work, whether it's equipment or procedure.
Should we get her out of here? Yeah. All right.
So we're going over auto extrication, the hazards of vehicles, manpower that it takes to perform an extrication and to effectively rescue somebody.
If you don't practice it, you forget about it, so when you need it, your recall is gone.
What we're reviewing is how to place different traction splint devices for femur fractures and also a pelvic binder device for pelvic fractures.
Our SMR is spinal mobilization restrictions, and what it's really talking about is how much do I need to do to be able to give the patient the most comfort but still be able to have the most safety.
And so the more that we can train ourselves, the better we're going to be on scene. Likewise, getting cross-departmental familiarization is huge, because in a community like this, we rely upon each other for support.
We're doing a class on crush injury and crush syndrome. The basic idea is that we're trying to bring awareness to all of our providers. The fact that sometimes when somebody gets a serious injury, a crush injury, the ugly soft tissue injury is actually the least of their worries.
Our section is over chest decompression. When the patient has trauma to the chest or gunshots or anything like that that lets air into the pleural space that collapses the lung.
Today we're actually introducing some new equipment to many of the first responders that are here participating. It's their first introduction to some of the equipment that's been added to the spinal mobilization tools for the Valley and for Mendocino County.
We're connecting with people that we don't normally see, but these are the people that end up with the people that we ship out, either in our ambulance or in another ambulance. They come to one of these hospitals.
It's great to see people from multiple agencies coming together, talking, networking, making sure that we can provide a better service to the community.
I think it's very important to be able to offer some opportunities like this, especially for pre-hospital, post-hospital settings, so they can actually see what it takes to get into a car.
It's really great for all the different resources and companies to get together and compare notes and see the whole process.
It gives communities that don't do this training very often a chance to use the equipment, especially the extrication, the SMR. It's really good for the BLS providers as well as the ALS providers in the community.
Ukiah Valley Medical Center, helping to improve and expand the continuum of care for Mendocino County.